Our Dr. David Agus joins us now to sort this all out. David, good morning to you. You know, when Dr. Fauci was here earlier, he said the cavalry is coming. I remember last week you said, listen, you were very excited about the Pfizer news. Now we've got news about the Oxford vaccine. So moving forward, what exactly does this mean for all of us?
Well, I mean, it really is hope in a bottle. You know, it's the notion that these vaccines can prevent spread of the virus. The critical question we don't know about these vaccines is, even though it dramatically tempers down any symptoms from the virus, are you still contagious when you're asymptomatic with the vaccine? The Oxford study that Charlie was alluding to is the only one that actually was swabbing people every week, and so we will know that data very shortly. And if that data show you are not infectious, there will be a much smaller tail to the curve, and we're going to end this sooner in the United States.
I like the sound of that. The Oxford vaccine, back to what Charlie was saying, seems to work very well with people in their 60s and 70s. How significant is that?
You know, I mean, obviously, people in their 60s, 70s, and 80s have much higher likelihood of symptomatic COVID-19, being in a hospital, many other complications. And if it works in them who classically have not as strong an immune response, we're cheering for joy, and that's very exciting. The Pfizer vaccine also showed a 94% protection in elderly. So that's exciting that these are going to work in the broad population.
Have you seen any side effects that concern you, David?
Well, what's interesting about vaccines, really over the last several decades, is that almost all vaccine side effects are in the first several weeks. In the first several weeks of these studies, we have seen side effects of fever, chills, pain at the injection site, you know, occasionally fatigue, but we have not seen anything that is long-lasting or very serious. And so that's in over 90,000 patients that have in total been vaccinated. So that's very, very positive.
A big story here in New York. We're going to talk to the mayor a little bit later on, but you know, the New York City schools have shut down after a 3% positivity rate in the city. Yet the bars and the restaurants remain open. The schools are closed. Does that make sense to you?
Well, obviously the priorities are a little bit strange, but, you know, the notion of an arbitrary saying 3%, you know, in the state of New York, that threshold is 9%, and not saying in schools that are doing it right with almost no infection, we're going to let them stay open, doesn't make a lot of sense. Broad policies in today's world, we can use data to make targeted policies for various neighborhoods and various disciplines. You know, schools are not the vector of spread right now in New York City, and yet we're shutting them.
Yeah, we had an interview with a little girl when her mom said, you're going to go back to home for schooling. She went, oh, I think a lot of kids feel that way. How does it affect your kids' mental and physical health? And not to mention how the parents are feeling.
Right. I mean, that's what I was going to say. The parents also are very similar to that child. You know, I mean, the children are isolated. Many children can't thrive educationally in those kinds of environments. They're distanced from all their friends. All the interactions are two-dimensional rather than three-dimensional, which our brains are designed for. So it is really difficult for children. We have to think of the cost of doing this. It's not just blocking virus spread. It is the long-term mental cost on these children that's part of the equation.
All right. We'll be talking to the mayor in our next hour. In the meantime, David, thank you very much.